It has been weeks since President Trump instructed pregnant women not to take Tylenol due to a potential link to autism and ADHD diagnoses. That advice ran counter to what major medical associations here in the U.S. have said for decades, which is that Tylenol acetaminophen use in pregnancy is safe and effective to reduce fever and pain, which can be dangerous to mom and baby. Now there is a pervasive sense of confusion and frustration among families that we spoke to, and doctors say they are fielding more and more questions.
The Sessa family is here at Tribeca Pediatrics on the Upper West Side of Manhattan for a well visit. Dana and Thomas have 3 kids under 10. Their youngest, 20-month-old Dean, didn't come to the appointment, but Dana, nearly 2 years after giving birth, says the environment for new and expectant moms has never been so uncertain. Dana, with all of the mixed guidance on Tylenol, you just had a baby not that long ago. What's been your response?
I have 3 healthy children. I took Tylenol with every one of my children. I find it incredibly sad we're in a point where we're putting even more onus on mothers for things that aren't based in scientific facts.
We met Genevieve in the waiting room. She's a first-time mom. Have you spoken to other moms, new moms, who are concerned about the situation?
Yeah, I think I've run into kind of 2 pools of moms where there's one set of moms who kind of continue and trust that kind of information, and then there's another pool where they're questioning that and the validity of that. Which I think is a really big concern. There's a lot of information out there, especially on the internet. So it's hard to know what's true and what's not. And I don't know, I feel for them.
The controversy surrounding Tylenol was stirred up during this press conference at the White House back in September. Flanked by top health officials, President Trump with this warning to pregnant women about taking Tylenol and the possible link to autism and ADHD.
If you're pregnant, don't take Tylenol.
One study repeatedly cited by the administration was published by Harvard School of Public Health back in August. It found children whose mothers took Tylenol in pregnancy may be more likely to develop neurodevelopmental disorders, including autism and ADHD. But in the conclusions of the same Harvard study, its own researchers noted while steps should be taken to limit acetaminophen use, the drug is important for treating pain and fever during pregnancy, which can also harm the developing fetus. The FDA says it is in the process of putting a label on Tylenol bottles warning pregnant women, but acknowledged so far studies do not show Tylenol causes autism or ADHD. Doctors we talked to say the conflicting messaging is creating apprehension.
I think that will cause a lot of people to avoid taking it when they otherwise should take it, especially in fever, like we talked about. I think it's misleading, and I think it's going to potentially cause more complications because of avoiding it.
Just this week, the British Medical Association published an assessment of 40 studies and reaffirmed what nearly every top American medical association, from the American Academy of Pediatrics to the American College of Obstetricians and Gynecologists, has said. There is no clear link between Tylenol use in pregnancy and autism or ADHD. Quote, existing evidence does not clearly link maternal paracetamol use during pregnancy with autism or ADHD in offspring. Since the first Oval Office gathering, Health and Human Services Secretary Robert F. Kennedy Jr. appeared to soften his stance. According to Reuters, he told reporters the data doesn't support a causative association between Tylenol use in pregnancy and autism, but it is very suggestive. The president, not wasting time, calling on him to clarify.
There were some false reports out about Tylenol that Bobby changed his view. I don't think he's changed.
I'm not going to change until the science changes, and the science does not look like it's changing. It's getting stronger and stronger. Every day, what we recommend is that mothers, pregnant mothers, talk to their physicians, that the mothers of small kids talk to their physicians, and we've advised the physicians to reduce the thresholds and to reduce the amount of Tylenol that they give to children as much as possible, and only use it when it's absolutely critical.
What do we do? How do we manage our pain around here?
But that hasn't cleared things up. Social media flooded with videos about Tylenol. OBGYNs like Dr. Molly Gilbert, who practices in Rapid City, North Dakota, are now fielding an influx of questions and concerns from their patients.
There's a lot of information out there, and it's making people really fearful and anxious about pregnancy and childbirth in general.
And that's also happening in pediatricians' offices across the country. Dr. Timothy Cicela of Tribeca Pediatrics says more and more parents are expressing frustration and confusion.
When you see this confusion, what's your response?
Yeah, pediatricians are being confronted by this on a daily basis with our parents, and we have mothers that are coming in who have taken Tylenol during pregnancy, and it's frustrating for us to have to have a conversation about something that happened in the past that the parents are now having fear, worry, or anxiety about.
We've spoken to doctors who say, look, it's a good thing that we're putting resources and turning attention to researching autism and the potential causes of autism, that's a good thing.
Yeah.
But it's too early in the process to issue new guidance. How do you feel about it?
Absolutely. Look, I spend my life taking care of autistic patients. We have many in the practice, and it's heartbreaking sometimes. And I would love more research being done. I would love to be able to look my patients in the face and explain more about it. So yes, please, I'll take all the research available out there and all the money that we can direct towards this. But this one particular item, I think, is a red herring.
For now, doctors say they're walking a fine line between validating patient concerns and defending existing gold standard science.
Did you ever feel like you as a physician would have to be sort of at the intersection of culture and politics as you give guidance to pregnant women?
No, I did not. It's hard to navigate, to be honest. It's really hard to be that person. And I think in some good ways, it's allowed me to really question my own understanding about all of these things, but trying to balance that and trying to steer people in the right direction and where to rely on their information from is not what I was trained to do, certainly.
Ariel Reshef, MS Now, New York.